All right. So thank you everybody for coming through. Thank you for your leadership, Rev. Thank you, Kevin, for coming to discuss about this topic. I'm gonna go ahead and pray. Father, you're such a great God. We surrender ourselves to you. We want to start this monthly meeting for many, many years. Thank you for your guidance. Thank you for your love and for allowing us to be here, Father. We love you and we thank you. We want to start with you this great conversation about our health. And it's in Jesus' name I pray. Amen. Welcome, Rev.
Oh, welcome. Okay, this is a great evening that we have set up to have a discussion, a live discussion, live mic, and welcome to Mental Health Stars Association. We like to mention that the word STAR is an acronym for Start Talking About Mental Health and Remove Stigma. That's what we try to do. And this is a very special month, the month of June, because we are raising awareness concerning men's health. And as you have seen, our topic is high blood pressure. I want to issue a disclaimer even as we welcome our special speaker tonight. And suggestions made here are never a diagnostic impression, a substitute for treatment or follow-up activities that are required and consented to with your doctor, psychiatrist, therapist, or a counselor. So for now, that's our disclaimer, and we welcome individuals to seek help as needed. Without further ado, we have our speaker who is ready. After his presentation, we are going to have a live discussion, whether we are two or three. It's almost like a Bible quorum where it says where two or three are gathered together. The Lord is in our midst. And of course, we have a theme scripture that's from Proverbs 11 and verse 14 that says, in the multitude of counselors, there is safety. So thank you so much. Let me welcome our speaker tonight, none other but Mr. Kevin Goge. Karibu sana.
Thank you much, Reverend Wamboy. It's a privilege and an honor to be talking about man on the Man Month, and just to pick a topic that is simple but very, very heavy and has a lot of good stuff to talk about. So we'll be talking about men this evening. Awesome. Always excited to be presenting about this topic and especially about men. So this is one of those discussions we come at once a month. Dinner table talks. We want to talk about health, and in focus this month is going to be about men. So let's jump on and keep going. I'll do the presentation and then I'll take questions towards the end. We'll make it interactive so everybody will be having a chance to say something, ask a question. If I can answer right away, I will. Can y'all see my screen? Can you see my screen now?
It's coming up.
All right, good. Can you see it now? Is it good?
It has started screen sharing. Personally, I haven't seen it. I don't know if the rest have seen it.
Are you able to see it, Reverend One Boy?
Yeah, there we go.
All right. You good? You can see it?
Yeah.
All right, great. Thanks. So we'll talk about men's health, and it's just a privilege to be presenting this topic this month. We've come together to bring awareness about the different topics of pressing or something that we see of concern, and I'll be sharing this from my own expertise as a nurse practitioner, what I see, and how we treat it, and how we can get better at preventing any further what we call like either complication or result of this particular disease. So high blood pressure, you go in and a lot of us hear about this term, but what does it mean? How does it come up? How do we measure it? And how does it impact our body, especially with a great focus on men? Men. We are men and we have to learn about this. So blood pressure is how hard your blood is pushing against the walls while moving through. So you look at this like a pipe, and I'll show you a small illustration here. Is how hard your blood is pushing against these walls. So this is just an example of when it's traveling. So as your heart is pumping and contracting, it creates a sudden pressure. When it's contracting, it's pushing out. Uh, we measure that as a systolic. That's the top number. When it relaxes, that's the diastolic, the bottom number. So this is just to help blood to flow through your body from your heart and just around the circulation. And that's what we're looking at the uh, picture there. Now, the bottom one, we'll talk more about it as we're looking at the different effects of what causes high blood pressure. The top one is just a clear section that has no, it's bending correctly. If you look at it, it's more clear and open. So blood is flowing at a good flow and has no barriers. When you look at the second one there at the bottom, that's what you have. It has a higher pressure and it's because of the plaque. The plaque is what accumulates as fat, sometimes calcium over time. So it doesn't come up overnight. It's an ongoing issue. But now, because of that, causes the pressure inside the vessel to go high. And that's what you get people with high blood pressure this way. All right, so hypertension is when the blood pressure vessels is too high. And we'll look at some numbers and ranges so you'll be aware of how it happens and what numbers we'll look for. Hypertension is a major cause of premature death worldwide. That's from the WHO. And also it's a silent killer. A lot of us, especially men, tend to push it away because it's not like something you wake up, hey, my limb is broken, I can't go to work. These are, we'll look at some of the signs and symptoms, and men tend to push it to the side or even take painkillers just to, kind of cut it off and be like, nah, I'm good, I can handle it. I'm okay, I don't feel bad. You can be walking, talking fine, but in the inside, like I say, this is not something you can walk to me and I see it. I might see some signs and symptoms, but it's more inside of you what's going on. Men are more likely to develop high blood pressure, and we'll look at some statistics shortly through age, especially middle age of life. So that's somewhere between 30 all the way to about 55. You see a lot of men struggle there with hypertension, but it's something that they tend to put away. Looking at the causes and risk factors, these are things some we can control, some we can't. Stuff like old age, those are things that happen to us naturally, genetics. Some people, because of their history, especially men, have it in their history and tend to push it away. I don't want to deal with it, but like, hey, grandfather had this problem, my father had this problem, but we tend to push it away. I'm good, I'm fine, I don't want to take no medication, don't want to go to the doctor. Being overweight or obese. So there are some people that are born and tend to have excess weight, but over time they accumulate too far. So this also causes or brings the high risk of having hypertension. Not being physically active, sitting down too long, don't want to get up and exercise. A lot of salt diet, and I know we like salt, but it's not good when it's causing the problem because it makes your body hold more water. And when you hold more water, you have more water to pump out. So just like a tank, when you have a lot of water, makes your fluid volume go up. So you have to work your heart harder to push the fluid up. So that's also another cause of it. And we see people that take a lot of salt lean towards having issues with hypertension. Too much alcohol, this also causes that as a downfall down the line. And then you have some underlying conditions, kidney disease, where your kidneys are not secreting some hormones correctly or getting rid of fluids correctly. So you end up having too much fluid in you because remember, our kidneys work by getting rid of toxins and also trying to get you to urinate to get rid of excess fluid. So some people who have kidney disease end up having high risk or already have hypertension. sleep apnea. I'll talk about this a little bit in the next couple seconds. And then thyroid problems also. We see this quite a lot. That's why I say some things you can control, some things that come over time you need to be aware of so that you can be ahead. If you manage your thyroid problems correctly and get it's noted early, then they're able to correct it and it helps to reduce your risk for hypertension. Illegal drugs, stuff like cocaine, amphetamine, you have marijuana, they make your blood vessels constrict. So what you're looking at there, this gets smaller and then the pressure goes high in there. So you have your pressure too high, and especially men, they tend to use more drugs than women, and because of that, you have most of them with this issue. And this is a downside of these drugs. So, and then you have introduction of like the new e-cigarettes, which nobody knows what's in there, and tends to be especially more in the younger men, 18 to 28 years old, that tend to have that. There's also stigma about hypertension and just going to the doctor in general among men. It's really, really high, especially in our African community. It's one of those things. I don't know what happened to us when we were little, and there's the stigma. You don't go to see the doctor unless you're in your crisis and everything is falling apart. So because of that, we see men tend to push this off away, because a lot of times hypertension will give you some warnings, some signs. And if you see those, you want to act on them rather than push them to the side. Men tend to be really impacted by the cultural stigma that we have in our traditions or just as Kenyans and even diaspora. So it's really, really good. We try to break that off. And it's just a simple thing as bringing your son when you go into your annuals and physicals. Let your son come with you, so he sees, hey, nothing bad happens. The doctor is not a bad guy, or the nurse practitioner. We're just providers trying to check on you and make sure everything is correct and working properly and catch things early. So stigma is a really big in our community. Then we have white coat syndrome. This is something that a lot of men struggle with, and we tend not to address it correctly or shy away from going just to even have a simple blood pressure check. Or when you're in the clinic, just for your annual physicals, your blood pressure is so high because there is that part of the stigma, and some people just fear the white coat of the doctor. It's really important that you just disclose how you feel. We have these cases come through, and we as a provider, we work with the person and the patient. We put you in the room. Some people like it to be on the side where there are windows rather than enclosed, because of maybe some history. So you want to be able to voice those concerns. Hey, doc, I'm fine. I'm okay. I just want to sit down for a minute before y'all check on my blood pressure or before I see the doctor. So that way your body, you're not responding like in fear mode or in crisis or anxious, just being in the clinic or just because someone with a white coat is in the room. So this is something that I've seen, especially men, especially it's really good to be aware of this if you're a truck driver. I'll say it again. It's good to know yourself, especially if you're a truck driver, and this is something that you find a fear of. It's good, so that way when you come in, you're correctly addressed, taken care of, and your provider is aware. Sometimes because of this, you might be given a little bit of homework and a machine to take home to check your blood pressure. So that way you're away from that, and we want to see your real-time numbers. Sleep apnea. This is something a lot of us men suffer from, and sometimes it can be corrected early, but it tends to affect hypertension. Sometimes when you're asleep, you might not know it, but you're lucky if you have a spouse or your kids or you have roommates, and if just listen to them. If they tell you, hey, when you sleep, you tend to take pauses, or they might say, hey, unalala lakini unangorota, very different. It's not a sequential thing. It's like you have breaks in between your breathing. So this can be managed and treated, and also is something that we have seen, especially in men. If it's not treated correctly and caught early, it causes other items of your body to start going bad. All right. Hope I'm in good time come now. Just ping me if I need to pause or speed up. All right. So we have looked at the definition and the causes. Let's move on to the next slide here, and we'll take a look at some of the statistics. So, how are men affected by hypertension? This is just a study I pulled out from one of the websites here from National Health Society, I believe. That's the site I use for this one. But I would like to just explain a few numbers here that are so. It's National Center of Health Statistics. So what you're seeing at here, and we're trying to see how are men affected by hypertension compared to compared to the women. So what you're looking at the first column here, that's like the whole population. When they did the study, they grouped both men and women, and they say, hey, what's the percentage of people in this group that have hypertension? So they found 47.7% had hypertension from the group that they challenged, they were studying. When you look at the male percentage, they had 50.8 of them that had hypertension. That's higher than even the group average. From the same population, they looked at the women, 44.6. So this tells you that men, we suffer from this more than women. And we need to do a little bit better just to be able to correct this. Because the other thing that I've seen, men come in when it's too late or when other body organs have started to be affected, like the eyes, and we'll take a look at that, or already diabetes, or even the kidneys have suffered. So this is just a part of the statistics. I did take a little bit dive into this, and this, that's why we create some of these forums to look at why. And they asked the same men from the same group, how many of them knew about hypertension or they were aware about it compared to the women. So 59% of the entire team that they were using knew about it. But look at the percentage of men. So men, you have about 55.2. That's the percentage they didn't know about this. Look at the women already aware about this ahead of us. So that's why we bring out this forum and we pick up topics to bring in, kind of discuss so we can have a better awareness of things around us. And because I believe hypertension, if you catch it early, you treat it, you get involved, and we'll talk about the prevention piece. You'll get a better outcome and prevent some of the catastrophic or even other organ damages that happen. All right. So we did talk about goals for your blood pressure. And you're like, yeah, what is Kevin talking about? So remember the top and bottom number? You have the top number. So we'll look at the bottom here. That's the normal where you want to be or less. And then you go, your doctor say, hey, you have elevated blood pressure. So here you might be told, hey, you need to exercise more, change your diet, things of that. We'll do some more labs and, look at your lipid pattern, stuff like that. But, you have to be engaged if you're here. Now, when you get to stage 1, you might have to be on a medication or stage 2, because here you don't want it to linger here too long or here and then start damaging other things in your body. Now, when you go to 180, here we can kind of treat you in a clinic and get you started. But over here, you might end up having to be in an emergency room to be checked and put on drips just to get it under control as soon as possible. All right. Now let's look at something else here. Signs and symptoms. Remember I said hypertension to some people is like a silent killer. They don't feel it. They don't, they just brush it away if they feel something very, very minute. So here are some signs. Men, pay attention. Headache, shortness of breath, nosebleed, sudden severe abdomen or chest pain. Some people feel it in the back. Some people lose eyesight. You can, I'll pick a example. I've seen men that come and we do the vision challenge, or we are doing the DOT check, and they could see 2020 last year. Now they come, they're like, I can't see that letter well. So, or you're at home, you're watching TV, and you're like, no, I can't read that line. I used to read, be able to see the bottom line. So these are just some telltale signs. Hey, it could be something wrong that you need to be checked. Some people have dizziness, fainting, or nausea. And most people, I left this there because most people that have hypertension, they don't feel the symptoms. Or if they feel it, like a headache, oh yes, I only get this headache when I'm waking up or in the morning, or when I have a lot of stress at work, or that's when I feel. You hear that conversation. So you want to be really, really mindful. And also, don't try to take a lot of Tylenol and aspirin to try to push it away, because sometimes your body is telling you something. The other thing, the only way to detect hypertension is to have your health professional measure your blood pressure. So these numbers here, we cannot tell them by looking at you just with your eyes. You need to have a blood pressure cuff put on, and either by manual or by equipment, to be able to get these numbers to tell you where you are. So, men, let's know our numbers. All right. Now, remember those symptoms? If we don't get ahead of them, this is what you don't want to happen. Some people go blind. We have seen people get a stroke. Some people, it leads to heart disease. And especially men, heart disease, we tend to come when it's too late for this too. Either the stroke hits, and this is when someone knows, hey, I'm trying to get up, I can't walk, or I fell this morning, or my arm, I can't raise it up. And you don't want to wait till that long. Some people have kidney damage, so you go to 1 year to your clinician, the next year, or if you skip and have a gap, next time you're going, he's like, hey, something wrong with your kidneys, what's wrong? So you want to be able to catch. Hypertension will affect these organs if it's not treated. Hypertension will affect these organs if not treated. And men tend to come when it's too late, especially for strokes. They have to it has to hit them, boom. That's when you see them. But remember, the signs were there. The signs were there. All right. How can we prevent and manage this? A couple items that we can do, especially for a man. One is change your lifestyle, less salt, limit alcohol, quit smoking. Sleep is good. Sleep is good. You want to stick to a DASH diet and then exercise. It's really important when you go for your annuals to be honest with your history of what you know about your family or yourself. And when you go to your annuals, this is reviewed every year. We also have medication that we use. We have diuretics, ACE inhibitors, calcium channel blockers, and beta blockers. And sometimes you might be on a combined dose, but you want to be so involved in this. That's why I put down compliance with the treatment plan. This involves where you have to do your part. Hey, what is the goal you want? Are you at home checking your blood pressure? Are you walking? Are you exercising? Are you counting your steps if you do? So you have that amount of involvement, or even follow up with cardiology, because sometimes if we cannot manage you by yourself, we have to add another specialty in the game just to be able to stay on top. So checking your blood pressure at home is important, especially when they're trying to find out, is this something one time? Is it something that is coming up on you slowly? Is it because of stress, or is it a white coat syndrome? Sometimes we'll give you a paper like, hey, go at home, take your blood pressure twice a day, in the morning and in the evening. Then your annual physicals. This tells a lot and helps to catch a lot of stuff. Relieve stress. Please. Delegate. Man, we tend to carry a lot, but it's good to have those, even if it's mentors or buddies that you can talk to help you break it down and carry things along your way in life. Stress a little bit is normal, but not every single time like you have this burden, because it causes you to have hypertension, and also We don't want to damage any of these organs early or go unnoticed. Men, let's know our numbers. All right. So that's all I have for my presentation. It's good to talk about men. I'll just add a couple items just to, I know I'm a little bit over time, but it's really important as men just to, especially when you go for your annual physical, if you have a young child, it's a male, just go with them, let them see you. You know, the doctor is assessing you, they're not beating you, they're not harming you. So that stigma gets to be washed off and cleared. So when there's their time to pick up and go and get it done, they're not running away, they're not shying away. Because hypertension, we can manage it, but we need to get it detected and managed early. Thank you so much. All right, back to you. Come now.
Yeah, this is awesome. Thank you. Thank you for that. I have a question for you. One is oh, is that stress causes, especially young people nowadays, is it because of food, what they eat, or so much because of stress? Is the trigger?
You have a combination of stuff. So especially for the young guys who are like maybe 18 to 25, there's a trial of these new drugs that's on the street. So that's one. And also you have sometimes just necessary stress and lack of knowing how to not only delegate but know your limits at a young age. They either take too much or sometimes just the pressures of around being that particular age group. But we also see a lot of because of food. Um, People going too much to fast foods, and I hope I'm not in trouble, but it causes a lot of issues down the line. Uh, the fried food, especially if you're in the South, we have more strokes and hypertension issues. I would say maybe cardiac problems in the South more than the North.
Hmm.
North people tend to walk more, so people now in the South tend to drive more. And when you see a lot of younger generation being into that, you know, driving more, don't want to do activities, no outdoor, and then just uh, they don't want to engage early with some of their requirements. Like I said, annual exams, physical should be as as young as 18. It should continue it every year. It doesn't hurt.
Perfect. Anybody else? Real question?
I have a question.
Yeah.
It is in double form, twofold. Now, are clogged veins, clogged vessels, the only cause of high blood pressure? And why do we emphasize on high blood pressure more than low blood pressure?
So I'll add, let me answer the first piece. For high cholesterol, so clogged arteries, they are not the only cause, because sometimes you have, it could be clogged, but it can be with cardiology intervention, they can put stents in. The clogging part becomes a problem mainly, especially when it's around the heart vessels, because you need blood to go to your heart, and not only inside the heart but outside. So if those vessels have plugs and plague or clots, cardiology has a way, if it's caught early, to go in and put the stents and sometimes clear it. But that's not the only cause, because sometimes also it depends on how well the blood vessel can contract and relax. If it's too rigid, it's not a good thing. It causes hypertension, because that means it's not expanding and contracting correctly, and it's maybe just staying so because of that, it will cause hypertension. So there are a few items that goes in just to manage it. But back to your question, it's not the only one. It's not the only cause of hypertension, but it can be managed. Now, the second question, low blood pressure is good, but you have to be very careful with it, because sometimes when it's too low, you might not get adequate supply everywhere. That's why people sometimes feel dizzy or pass out a lot. So you want to be very careful with that. Now, one of the side effects to really manage with the blood pressure medication is to make sure you're not on the lower aspect of it. Like, for example, like 90/80, because sometimes it becomes not even safe. And it affects, when it's on the lower side, it affects your equilibrium. Like if you're trying to sit up and walk, some people will have falling. And also when it's too low, it can cause some trouble with your mentation also. So we tend to like the sweet spot of below 120/80 or right there 120/80, but you don't want it again too low, below 90/80, and it depends with the person. There are some people that do well with it being low, but you need to be really closely monitored with your primary care or cardiology to make sure that it's adequate, even if it's low, to make sure it's adequate. Because if it's too low, sometimes we have to add medication regimen to bring it up a little bit to a, it's not everybody's not a cookie cutter when it comes to this. Some people might be easy to control, and that's why I say it's good to have a good follow-up. If they give you one medication to take and record your blood pressure, record before and after, so that way they are knowing where you are. But yes, I hope I answered your question, but
Yes.
Did I answer?
Very, very much.
All right.
Hold
Yeah.
on.
Anybody else? We have another 5 more minutes. Anybody with a question? I'm gonna go disconnect on YouTube. Thank you, everybody, for joining on YouTube.